Hi everybody. First of all, I must say that I'm really proud of being here. I'm also a little bit excited as this is one of my first time public speaking, so be patient. And as Jean said before, I'm a medical student and I'm going to attend my third year at med school in Novara. And I first came in contact with the Happy Degrowth movement, thanks to Jean and other friends, just after following the conference of slow medicine in Turin last November. So it was, yeah, it, um, it helped us make friends first and then start a discussion about the possible role of medical students within degrowth. So let's talk a little bit more about, the background. In 2011, the Doctor for Degrowth Manifesto came to life, and it is made up of 10 criteria. And this arose quite a lot of interest for people in the field. And similarly, there is a sort of, criticism and problems that need to be tackled within medical schools as well. And that's the reason why, as medical students, we speak a lot about the need to renovate curricula, adapting them to present days, and with special regards to deterioration of consumer society and capitalism, climate change, and then new technology available, today in 2012, as we are the so-called Generation 2.0. Something that can be added to this is the interpretation of medicine as an art in the Latin sense of skill, practice, arts, and this is a well-known painting by Rembrandt, Anatomy Lesson, and of course everyone knows the weight of theory in a field such as medicine, but practice and collaboration are also key features for a good curriculum and to provide future society with expected better prepared medical doctors. What's characteristic about medicine is that it is a science, but it is also a social science, as it was described by Virchow in 1848. Besides, in medical nemesis, Ivan Illich stated that another main goal of medicine is to relieve, to support, and healthcare in general, and to rehabilitate and to make life not only tolerable but rich. So that's a lot more than just pure science and the pure application of it. So, as medical students, can we have a possible role within degrowth and the degrowth movement? We main focused on three main axes of work. I am degrowth, medical students and degrowth, and advocacy towards the whole of the society. So for the first point, the focus is mainly on lifestyle and ways to implement buen vivir at college. And I think that most of you have notion of know what buen vivir means to the degrowth community, or kind of. The second point focuses mainly on the curricular reform in the School of Medicine and the role of the group. And for the third one, we would like to think about future medical doctors as facilitators of health within their community, and plus we will focus on the importance of taking position on social issues. Okay. So about rethinking medical students' lifestyle, some ideas that could be implemented are measuring freshmen's ecological footprint to suggest improvements in their single lives, and then implementing transition, which involves focus and a lot of thinking process, and then the value of cooperation among peers. And I would like to remind you of an interview that was made available online, an interview of Professor Mercalli, and he stated the importance of the value of cooperation as a key value to the future, as opposed to competition. And as a collateral, he also stated that he hates sports for that reason, but this is joking. Some hints are co-housing, synergistic gardening, and then ethical purchasing groups that in Italian are known as GAS, GAS, Gruppi di Acquisto Solidario. Okay. As for university, we would like to think it as a place of buen vivir, and that was, of course, School of Athens by Raphael. The word school actually derives from the Greek skole, which originally meant leisure and free time. So we would like to bring back the original meaning of the word. A present learning environment is supposed to have a beneficial effect on learning itself, and so many people have been saying that over centuries, I guess. Learning by doing is a key feature of a good curricula. And then as medical students, we would like to charge us of the duty to advocate for best practices, such as recycling and organic food made available at the school canteen, installation of solar panels, and so on. All right. Okay. So some ideas again. The establishment of a network of transition med schools inspired by the Slow Cities movement. Introducing new ranking criteria. For example, the ecological footprint and the Buen Vivir index to assess colleges, thus rewarding the top eco-friendly ones. So there could be a change as regards criteria to judge the top universities within a country that could be Italy or any other. As for medical schools and degrowth, are we actually going towards curriculum reform? Medicine is a vibrant and constantly evolving science. Therefore, is it worth thinking that medical community should agree? It is worth thinking that the medical community should agree on the ultimate goals of healthcare before introducing any reform. So the basic concept is, before we, first of all, we try to define something, and then we try to implement it and to put it into action. Maybe we can skip something because I'm a little bit late, and then I think that we can make this presentation available for those of you that could be interested in it. Um, so, as regards the last point, advocacy towards society, medical students can really make a difference in the promotion of a healthier, fairer, and eco-friendly lifestyle. So we seek an implementation of the so-called Think Global, Act Local strategy. And again, as in any attempt of transition, here too, we must focus a lot on the process itself. Some suggested ideas. Following a leadership training to become healthcare referral experts or advisors within our own community, and then taking position on social issues and in case human rights violation concerning patients or minorities in our community. Supporting open access as well. So let's move. Well, I also wanted to briefly introduce my the association I belong to. It is SISM, Segretariato Italiano Studenti Medicina, which is part of worldwide network of medical students. So, as a conclusion, I would like to read together with you some words quoted from Illich's medical analysis. One must not only consider the length of life, but the quality of life judged by the productivity and comfort of the individual person, as well as the burden to his family and to society as a whole. This caring function, in distinction to the curing function, enables physicians to relieve, to support, and to rehabilitate, to make life not only tolerable but rich, as I quoted briefly also in the introduction. So this could be summed up as follow, maybe. And health as buen vivir, as promoting well living, maybe can really bring about meaning to our lives. Thank you.